I'm Nicola from Adore Yoga. Welcome to this information session on yoga therapy. So this session is designed for accredited yoga teachers who are interested in learning about yoga therapy. Perhaps you're considering studying yoga therapy, taking one of the accredited courses. So what we're going to do in this session is learn a little bit about how yoga therapy supports your students, your clients, how yoga therapy supports you in your career as a yoga teacher, and how you become a yoga therapist. So yoga therapist is quite different to a yoga teacher. We're going to look a little bit at what that difference is and what studying yoga therapy can mean for your career. I'm going to do a little bit of flipping around, sharing my screen. So bear with me while I flip around on my screen a little bit so I can share the screen on my computer and you can see what we're doing. So we'll be looking at how you can become an in-demand yoga teacher, but without diluting your authenticity. So with yoga therapy, you can differentiate yourself with integrity and authenticity. It helps you to build your yoga skills and confidence. Yoga therapy is a very comprehensive training program. You get a very full and in-detailed training in anatomy, in yoga philosophy, in yoga psychology, in intake. So when you first assess a student, to using yoga and Ayurveda techniques for assessing what a student needs, and then practice design and communicating that practice to your student, following up with your student, and learning how to do that in a way that is appropriate for many different types of students who are living with different health issues, mental health, physical health, and emotional health. So at the end of a yoga therapy training, you have a great deal of confidence backed up by a lot of skills to do the work. And you will also learn how to safely and effectively support students with serious health issues. So more and more yoga is becoming well known in the general population through media reports for being helpful for a lot of particularly lifestyle diseases that are not easily cured through Western medicine, that don't respond to surgery or antibiotics or other drug therapy. So this could be autoimmune diseases, cancer, chronic pain, neurodegenerative disease. And so yoga is able to provide an evidence-based modality to support many people with these diseases to better manage their well-being. Being a yoga therapist can also increase your earning capacity because you will be a specialist, you will be highly trained. Yoga therapists are well respected in the community. They work privately, they work publicly, and you can earn more money privately as a yoga therapist than you can just teaching group classes as a yoga teacher. So starting mindfully, if you could turn off your mobile phone, close your apps and all of the multitasking that you might have been doing the last few minutes, and so let's monotask for a little while and just focus on what we're doing right now. So where are we? This is actually my house that we're in, and what you're seeing in the photograph there is a group of students in my kitchen, and they're with Sunita, who you can see there in the center, looking at Ayurvedic food. I think they're making chai in that picture. And so because we do the program, the professional programs at my home, we have a large 40 square meter studio that I'm in now, and in a little bit I'll take you on a video tour so you can see around. It's a very relaxed environment. We have a sunny deck where people have their breaks. There's a pool for summer. We have a fridge, a microwave, tea and coffee in the kitchen area. You'll meet my cats and my kids, and there is a big family vibe. As you can see from that photograph, everyone's pretty relaxed, even heading off to the kitchen to learn to make some Ayurvedic food there. And Ayurveda is a very important part of particularly our course because it forms a really firm foundation for your assessment of students and knowing which techniques to use to support students with different health issues. So this is me. That's me in Myanmar last year. I am the director of Adore Yoga. I am an ERYT 500 with Yoga Alliance. I'm a certified yoga therapist, that's a CIAYT with the International Association of Yoga Therapy. The MCAP is a master's in counselling and applied psychotherapy. I'm also studying for a master's degree in public health, and I have about 25 years experience of studying yoga. I trained in the tradition of Sri Krishnamacharya. If you're not familiar with him, he's often cited as being the grandfather of modern yoga. So if you've practiced vinyasa yoga, you've probably practiced with someone who trained in the Krishnamacharya lineage, because much of that comes from Ashtanga, and Krishnamacharya trained Pattabhi Jois, who developed Ashtanga. If you've practiced any kind of yoga where you use props, or Iyengar yoga, Iyengar was a student of Krishnamacharya. And Krishnamacharya taught a therapeutic form of yoga, in that he taught the person, not the practice. And we'll look a little bit more about that in a few minutes, what it means to be teaching the person that you're working with, rather than focusing on what practice you're teaching. So why yoga therapy? Well, I think our graduates could probably explain that better than me. Those are some of our graduates, and that's last year's graduating mob. So our graduate yoga therapists came from all kinds of backgrounds. Many of them had had health issues themselves, and they found yoga extraordinarily powerful in healing them. Many of them were also working with students who had significant health issues, and they wanted to make sure that they could genuinely support those students safely and effectively. So after doing their yoga therapy training, what are they doing now? Well, they're doing lots of different things. Many of them are working in public and private hospitals. So following the model in Europe and the United States, more and more public and private hospitals and clinics are understanding the benefits of yoga therapy, because there's been a lot of research now. And so many of these facilities are engaging yoga therapists to go in and work in special populations. So some of our more recent graduates are working in mental health, working alongside psychologists and psychiatrists in hospitals and clinics, and particularly working with trauma, PTSD, anxiety and depression, and eating disorders. And there are a number of others who are working in oncology environments, so working with cancer patients. And I know there are some who are working with neurodegenerative disorders, so working with dementia and Parkinson's and aged populations. Many are working with allied health professionals. So at least 2 of our graduates from last year are working in clinics with psychologists. There are others working with osteopaths, physiotherapists, occupational therapists, and other allied health professionals who also understand the benefits of yoga therapy and are referring their clients on to work with the yoga therapists. Most of them are also working in private practice, and that might mean that they've set up in their own homes. It might mean that they're working out of local yoga studios, or they've set up their own rooms, they're hiring commercial premises. There are several who are working in mental health facilities, and others who are consulting for non-profits. So there are a number of charities now who have funding for therapeutic yoga with special populations, homeless populations, domestic violence, veterans, mental health, cancer. So a number of yoga therapists are also working as consultants and trainers in those areas too. So you can see that when you work as a yoga therapist, there's this much broader world that you can be contributing to and making a significant difference to the lives of many people through yoga. So what is yoga therapy? My yoga therapy story is that I had no idea what yoga therapy was. I hadn't heard of it. I don't know that the term had even been coined back in the early 90s when I first came to yoga. I was an undergraduate studying for my first honours degree, and I was living a pretty unhealthy lifestyle. There was drug and alcohol use. I'd been experiencing significant depression, and I had a breakdown. And as a result of that, I had some pretty nasty symptoms, claustrophobia, agoraphobia, panic attacks, and the panic attacks escalated to a point where I struggled to leave the house. And I had been offered prescribed medication by a doctor, and it had some pretty unpleasant side effects. And so I took myself off the medication, and my symptoms intensified. And a friend of mine who practiced yoga for many years suggested that I try a yoga class, and I wasn't very impressed with the idea, but I decided to give it a go because I was ready to try anything that might relieve my suffering. And so I went along to a yoga class, and this was before yoga got very popular. It was a bunch of much older people, and it was in a community sports facility, and I was very anxious about going in, and I hated it. I didn't like it. I felt uncomfortable. I didn't feel any affinity with the practice. It all just seemed like gobbledygook. But having said that, there were very short moments in that class, just a few seconds, where I stopped feeling desperate, or I stopped feeling that I didn't want to wake up again tomorrow, or I stopped suffering so intensely. And I didn't feel wonderful. I didn't feel cured or fixed or transformed, but my suffering stopped. And I had gotten to a point in my life where I wasn't sure that the suffering could stop. And having had that experience, I took hope from that class. And even though I didn't enjoy it, I went back, because I figured if I could have a few moments of respite from the suffering, from the misery, then maybe I could get longer periods of time of not suffering, and perhaps there was hope for me to recover. So that's exactly what I did. I carried on going to classes. I was very fortunate to have found a teacher who had studied in the Krishnamacharya therapeutic tradition, who was able to understand some of my health issues and was able to prescribe some practices that were specifically designed to help me manage the mental and physical issues that I was managing. So I credit yoga, a therapeutic form of yoga, with saving my life at that point when I reached rock bottom. And I started to study yoga to try and find out what it was about this approach to yoga that had made such a phenomenal difference. So I studied in the tradition of Krishnamacharya with many teachers, including Krishnamacharya's son, TKV Desikachar, and many other students who had studied directly with Krishnamacharya. I also went and studied mental health from a Western perspective with my master's in counselling, and now I continue my studies in public health to try to understand how we can apply these principles of therapeutic yoga to public health to improve the well-being of more and more people. And so part of what was so good that came out of my initial experience of yoga therapy is that I have spent the last 20 years working for myself with yoga therapy, but also supporting other people to train as yoga teachers and now as accredited yoga therapists. So I've been training yoga teachers, therapeutic yoga teachers and yoga therapists for over 15 years. And so teachers who train in this tradition can confidently support students with serious health issues. They get a recognized national yoga therapy qualification when they train at Adore Yoga. They build a yoga career without taking the Instagram yoga celebrity path, so you don't need to build notoriety to compete in this market. And students and graduates get to do something heartfelt and meaningful with their lives, but they also get to pay the bills. And so in that picture, that's my studio, and those are some of our students' practicing a therapeutic practice. And one of the things that you'll notice in that pictures, which is very typical of yoga therapy, is that everybody is doing something different. So you've got two people who've got their legs up on a chair, you've got somebody lying on their side, you've got someone lying on their back supported by a bolster. And it's also a very small group. There's actually only 8 people in that room. And this, again, is very typical of yoga therapy. So one of the key differences in yoga therapy is that you're not working with mass groups where it's a one-size-fits-all practice. What we're doing is working with smaller groups and individuals and tailoring everything that we offer to meet the needs of those individuals based on their particular profile. So yoga therapy is about to be pretty big in Australia. I've been traveling to America to the yoga therapy conferences there, listening to the research papers being presented, looking what yoga therapists are doing in the States, and it's colossal. Yoga therapists are in hospitals. They're covered under the equivalent of work cover in some instances. And yoga therapy is now being introduced into more and more facilities, and there's quite a demand for yoga therapists, and that is going to happen here. We're already seeing it in the public and the private health system. So how do you design yoga therapy practice? What is it? As I was saying before, it's less about the practice and more about who you're working with. And as a yoga therapist, you do not fix or cure or heal a student. That is what the student does for yourself. What we do as yoga therapists is we learn the foundational principles of yoga, those key practical and philosophical principles of yoga. And then we learn how to apply them to individuals according to their therapeutic needs. So you cannot separate the practice from who you're teaching and what their particular health symptoms are. So the practice that you develop as a yoga therapist must suit this particular person and the specific health issues that they have shown up with. So we take into consideration a person's age and personality and preferences and experiences and backgrounds and culture. We also have to take into account their health history, why they've come for yoga therapy, other comorbidities, other issues that you might need to take into consideration. And when you understand those things about that individual person, you can take your deep knowledge of Ayurveda, of yoga philosophy, of yoga psychology, of anatomy and physiology, and you apply that knowledge to the needs of this individual person. So that is what makes yoga therapy very different to general yoga class teaching. So we're teaching the person, the purpose for which they've come to yoga therapy, and we provide a practice that meets their needs, working within their capacity and tailored to meet their emotional, physical, and psychological needs. So how does yoga therapy work? It is not Googling yoga for sciatica or cancer or heart disease or anxiety. If you try doing that, you'll notice that you come up with billions of answers. But you'll also find that those answers can be very contradictory. What this yoga practitioner's opinion says might contradict this yoga practitioner's opinion, and this style's approach may be different to that style's approach. There are a number of reasons for that, but mostly because the answer is not to be found through generalizations. Because remember, we are never teaching yoga for sciatica or for anxiety. We are teaching this person who may also have anxiety, who may also have sciatica, who has a lot of other things in their life, in their psychology, in their history, in their preferences, that mean that we cannot just apply a one-size-fits-all practice across the board. So we learn to understand and use the main lenses of yoga. So these would include things like doshas. So we talk about Ayurveda. We look at the doshas, the imbalances in the doshas of the students who come to us. We will look at the koshas. So those are the layers, the bodily layers, the breath layer, the mind layer, and the higher intuitive and bliss layers. And we will look to see where the students' health issues are showing up in those koshas, in those layers. We'll look at the vayus, which are the different pranas, the energy systems in the body, and how the students' health issues are showing up in the vayus, or how through working with the various pranas in the body, we can positively support them to influence the healing of their health issues. We'll look at the gunas, so those key foundational qualities that is in all of us and all of nature, and learn to understand whether the tamas and the rajas and the sattva, how they are manifesting in this student at this time, and how they're implicated in their health issues, and the kleshas, the causes of suffering, how those are implicated in the student's health. Now, don't worry if you are not familiar with all of these foundational aspects of yoga. You may have covered them in your yoga teacher training. You may not have done. We don't assume that our students are already proficient in this. This is part of what we do in yoga therapy training. So in summary, we see the person and not the disease. That is the key difference in yoga therapy. So what is the secret to being a successful yoga therapist? Well, you're differentiated. You are no longer competing with the fitness-based teachers, the Instagrammers, the novelty yoga practitioners, whether it's yoga with beer or wine tasting or dogs or goats. You're doing something that is quite different to other teachers out there. And you will have acquired world-class skills. So accredited yoga therapy training is the world's most advanced yoga teacher training that is recognized. And confidence, that goes a long way. So you'll know if you've had yoga therapy training that you are able to help people to transform their health and their lives. Now, before we talk about becoming a yoga therapist, I might give you a little tour of our facility because we've been sitting down for a long time. So come with me. I might stop sharing my screen so we can see the whole thing. Okay. So we're in the yoga room right now. This is a 40 square meter space. It's designed to be very calm and tranquil. It's got natural bamboo floors. There's Skelly in the corner there for our anatomy. You can see that there's glass at either end of the room, so it is beautifully bright. We have all of our props here, bolsters and blocks. So this is the main room. We have our air conditioning, so it's never too hot, never too cold. And here's the outdoor area. Let's go outside and see what's happening. It's a bit windy in Sydney today, so we might not stay out for very long. So this is our deck where students come and relax. And this is where people have their lunches and chat. It's a nice green leafy space. And, come with me, on nice sunny days, it's sunny today, but it's not very warm. There's even a little pool down there to swim in. So sometimes, if it's nice and hot, you can bring your swimmers. I think we'll go back in. It's a little bit chilly, but that's the that's the deck area where we all come and relax. Back into the yoga room. So through here, Skelly again. He looks like he's been told to stand in the corner. Through here we have our kitchen area, so that door goes out into the deck, and that's all the tea stacked up there in the container. There's a fridge, there's a microwave, there's washing up facilities, so that's our kitchen area. And through here we have our bathroom. It's a particularly glamorous bathroom. Anyway, there we go, there's a bathroom, there's the sink. Oh, there's me in the mirror with my laptop. And coming through, here is our entranceway. And down here we have our library. So there's quite a lot of books in the facility connected to yoga therapy, which our students are very welcome to borrow and use during the course. Go back into the yoga room. So it's a beautiful, bright, relaxed space. And we never take more than 16 people in this room to keep it nice and comfortable. We keep the group small because it enhances learning. It means that you build a better one-on-one relationship with the teachers in the course. It just makes for a nicer experience. Now I am going to share my screen again. There we go. So how do you become a yoga therapist? There are 2 steps. The first one is the 150-hour foundation of yoga therapy. That is a bridging course. That is only necessary if you are a 200-hour yoga teacher. So if you already have 350 hours, 500 hours or more, you do not have to do the foundations program. That is only for 200-hour yoga teachers to qualify for the full graduate program. So in Australia, in order to start accredited yoga therapy training, you must already have 350 hours recognised training. So if you already have 350 hours or you've done your 150-hour bridging course with us, you can then go on to the graduate certificate in yoga therapy. And that is a 650-hour program. And here's how that works out. So the 150-hour program, that goes for 6 weeks. We run that once a year in January, February, at the beginning of every year. And it's 3 4-day blocks. So Thursday, Friday, Saturday, Sunday, 3 approximately every 2 to 3 weeks. And that's 100 hours classroom, face-to-face time, and 50 hours of home study. There's some reading, there's some practical work, there's some teaching practice, and there's a little bit of homework, a little bit of assignment writing. And that's a Yoga Australia recognised postgraduate training, and you will be able to upgrade to a level 1 Yoga Australia recognised teacher at the end of that. And then you can just walk away, or you can come back and finish your yoga therapy accreditation. And that is the graduate certificate in yoga therapy. You can do that in 2 years. That's the minimum amount of time you can complete an accredited yoga therapy training. So if you run into a course that's offering accreditation in less than 2 years, it's not a Yoga Australia fully accredited course that follows the guidelines. You must take 2 years. We also offer it as a 4-year flexible modular pathway. So if you need a little bit more time because of work or family, or you need more teaching practice hours, you can take up to 4 years to complete the course. So those 650 hours are broken up into 12 modules. Each of those 12 modules goes for 4 days, Thursday, Friday, Saturday, Sunday. And that combines 300 hours of face-to-face classroom study here in this room, and 350 hours of home study and practicum. So that practicum is done in your own time outside of the classroom, and you are mentored through that. And that might be face-to-face mentoring. Many of our students fly in from around the state and interstate. This term we have students from WA, ACT and Queensland. Last year we had an international student flying in from Bangkok. So we can manage those mentoring sessions online so that you don't have to keep coming back to the studio in between the study blocks. And once you complete that 650 hours, you will have completed accredited registered yoga therapy training, and you can register as a yoga therapist. So some of the questions that we get, do you have to attend all of those 12 modules? The answer is pretty much. The minimum to pass is 80%. And if you miss sessions, they can be made up through mentoring, most of them. Some of them involve practical skills that you have to do in partnership with other students, in which case you can take that module the next time it's offered. Can you dip in and out of the course? Yes, for the graduate certificate. So no, for the 150-hour bridging course, you just have to do it straight through. For the grad cert, you have to do module 1 first, but once you've done that, all of the modules in stage 1 and stage 2 can be done in any order over 4 years. Can you get RPL? only for modules studied with other recognized yoga therapy trainings. So you might have already done some anatomy, you might have already done some philosophy, but the way in which those subjects are approached in yoga therapy is quite different. So we will look at granting recognized prior learning if you have studied on another yoga therapy teacher training. And are there any scholarships? Yes, we do have limited scholarships and bursaries each year for the graduate certificate only, and those are, they have gone in the past to people on a pension, people with a disability, and single parents as our priority. So how do you join the course? Fill in the application form. There's a short interview. That's for the grad cert, for the 150-hour bridging course. You just apply online, and we would require the deposit booking, but not the whole amount. We have payment plans to make that a little easier for you. So we invite you to find your passion for yoga, to come along and talk to us at Adore Yoga. We can organize a private one-on-one mentoring session for you so that you can ask some more questions. We can chat to you on the phone about the course. We can look at how we can tailor your particular needs and timetable to the course requirements to make it as flexible for you as we possibly can. So I'd like to thank you for coming along. Thank you for giving up your time today. We have programs starting for the graduate certificate twice a year. There's usually a start in August and another start in March. And you can find all the details of our next starting dates and course dates and times at adoreyoga.com, and then click on the teacher training tab and you'll see all of the dates. There's a prospectus and a full curriculum at that website. Or get in touch, call me, and we can speak soon. So I encourage you to join us. There's some more graduates. I think that was 150 hour in the summer. There they are, looking pretty pleased with themselves. So we would love you to join us. Let us know if you have any questions. And thank you again. And I hope to meet you soon. Have a great day.